Welcome back to The Story. I'm Maggie Vespa. Dan is out this week, and we have been dealing with two historically big issues this week, racism and the pandemic. And as it happens, unfortunately, those issues overlap. We got this question. We'll start with this. This is from Robbie. He says the Oregon Health Authority released a statement saying that people of color should get tested for COVID, along with migrant workers, people who work in prisons or live in prisons, etc. There was no scientific evidence offered up as to why people of color are singled out. It goes on to say, I thought COVID didn't see things in terms of race. Okay, well, technically, yes, scientifically, the virus could infect anyone, but it's true that COVID-19 is disproportionately affecting communities of color. Here's the hard data. As of May 1st, people of color represented 40% of COVID-19 cases in Multnomah County, but only make up 30% of the population. The county says Latinx and Asian Americans are also more likely to be hospitalized from the virus, and most people who have died from COVID-19 live with chronic health conditions, which occur in much higher rates for Black people. Now, outside of these numbers, people of color are more likely to have jobs that involve interacting with the public, and they've historically had unequal access to health care and healthy jobs, homes, and lifestyles. The director of the Oregon Health Authority acknowledged all of that this week.
A centuries-long history of racism and oppression have led to the very health conditions that exacerbate the impacts of COVID-19. At OHA, we've been too slow to recognize that threat and act on it. For that, I'm truly sorry. This is a time when people are angry, hurting, and afraid. I want to acknowledge those very real feelings. I want to acknowledge the failings, including OHA's and including my own, that have contributed to them. OHA will do better. I will do better. We have to.
So he says OHA has met with leaders who belong to communities of color, and they're working to improve race and ethnicity data for COVID-19 just to better understand how it's affecting different communities. And they also want to improve access to testing, treatment, and support services. And they want to give those more vulnerable communities priority when it comes to any new treatments or possible vaccines.